So, again, I'm excited to share a little bit more about the NeuroRehab apps, the pediatric apps, and the direction that we're headed in terms of supporting the neuro content, the neuro curriculum. And I'm excited to have Kathy here with me today to share a little bit about how she's used the app, why she developed the app. I have been at Azusa Pacific. Kathy and I have been there almost the same amount of time. I've been there 17 years, going on 18. And my specialty is actually in orthopedic manual therapy. I'm a teaching and learning fellow at the university. We use a lot of these apps in residency and fellowship education. And really, the goal of these apps was really to support education and take it to the next level. Because of my own personal struggles with the resources that I had to connect the dots, to help students really begin to see the big picture, to learn motor skills. I was just tired of having to teach motor skills through pictures and words. So I also chair the Institutional Review Board at the university. And I'm just going to mention Kathy here. Kathy and I have been enjoying being colleagues for probably close to 15 years, if not more. In fact, Kathy was my mentor in my residency and fellowship. And she has the unique role of playing a very well-respected NCS and OCS. And so she plays a role in many different areas and has taught for many years in our neuro curriculum. So she's a full professor at APU with me. She's a faculty at the Kaiser Permanente Spine Fellowship and Sports Fellowship. And congratulations to Kathy on her recent release of her and the entire author group for the Concussion Clinical Practice Guidelines. So this I know has been a major work. We are undergoing our own guideline process right now for the red flags medical screening guidelines that I'm a part of. But Kathy, congratulations to you. That's really
thank you. Well, it's the gift that keeps on giving.
Yes, every 5 years.
As soon as you finish, they want you to do the revision. So
right, exactly.
You never stop.
It'll never stop. And then I just also want to mention Rachel Tabak Tran. So Rachel did her training at the USC Rancho Los Amigos Neurologic Residency Program. She was the mentor at Casa Colina Neurologic Residency, and we knew that she was the perfect person to do the NeuroExam app, to film all the techniques we would need for entry level related to neuro. She was also the 2015 Academy of Neurology Early Career Award recipient, and is now the director of oncology residency at City of Hope. So she is a mover and shaker, and we are always thinking of new things to do together. We're beginning to design content for the oncology residency.
Hey, Mike?
Yes.
So are you recording this?
I'm recording this, yes.
Perfect. Okay.
Yeah, because I know.
want to refer back to it later.
Yeah, exactly.
Perfect.
And then today, actually, I'm excited that we have now moved the NeuroRehab app into the beta test platform. I'll show you that. I'll show you how Sara uses it in her program. And when I first heard from Sara that she had created this, and this was how she was using it to teach her students, it blew my mind. And I said, we have to bring this to the faculty so that they can help their students really connect a lot of the dots. So Sara and I have had many wonderful conversations. She's an associate professor at MUSC, Medical University of South Carolina. She's the neurology residency director and the APTA Neurology Section Excellence in Neuroeducation Award recipient. So, really an amazing professor, and excited to share with you some of her work. And then also just to announce that PhysioU and JOSPT have developed a strategic partnership. We are leveraging our expertise in educational technology to help clinical practice guideline content come to life. So all of the clinical practice guidelines will now have videos of tests, techniques, interventions, so that you don't just have to read about it, you can see what the guidelines suggest that you should do for interventions and examination. So this is a big move for us. We're excited to partner with such a well-respected journal. All right, so I'm going to move straight in to some different ways that you can use the PhysioU Neuro Apps in particular in your online classroom. So first I want you to take a look at the NeuroExam app. And I was going to have Kathy share a little bit about why in the world did we build this. It was a lot of work. So Kathy, you want to speak in a little bit about this?
Sure. So we decided to do this because there's just so many tests. So this was meant to help more on the assessment end of things. And then, students only kind of capture a portion of what you do, and then they forget, and then they'll ask you, well, what was that again? So what we did was we just filmed every neurological test under the sun that we could think of. And so what it's done is it's given the students something to look at ahead of time before they get to class. So we usually tell them, today's going to be balance day. We're going to go over, the Berg, DGI, tug, and whatever. And then your assignment is to look at that ahead of time. So the students will familiarize themselves with the test before they get to class. And then when they get there, they've seen it before. So the demonstration usually runs a little bit quicker. And then what that's done is it's freed us up to talk about like when you would use this test, like why you choose this test over another test for a particular case study. So it lets us focus more on the clinical end of things versus the mechanics of the test. So I think that's probably the biggest thing that it's changed for us. And then they have this whole library of other stuff. And this includes not only this app, but all the other apps that the students can then refer to. Because, for Mike Wong and I, we started out with a class of like 36, way back when, and then it grew to maybe 40, and now we're at 75. So just because of the sheer numbers, it's hard to, herd all the cats together. So it gives us a chance to kind of make sure that the material is at least there for them to refer to. And then we can at least, answer questions as they come up. But there isn't a lot of stuff getting missed because the resources are already there. So I think that's the main thing.
Yeah, and what have you experienced related to how the students respond to these resources compared to what we had before?
Oh, they love it. They love it because everybody's into apps and watching things anyway, right? So before they would either have a hard copy of a PDF or they would have a textbook. Well, they don't actually buy the textbooks, I think. Or if they do buy it, one of them buys it and they share. So they have this community textbook maybe, and then they have a PDF on paper. So compared to that, to be able to actually watch somebody do the test again, to watch how the setup is, and then everything's written out too. So the equipment, the measurements you need, what the norms are, all of that is embedded in this, in this app. So everything is together. So the students love it.
Yeah.
What they don't like is if you don't explain things. Not that we would ever do that, but this app in particular is good for setup for class and for reference, but it's not necessarily, take place of this clinical discussion of what you would do with these tests and what they mean.
Yeah, I think we found the same thing when you look at how we've tried to organize the different tests. So when you log into PhysioU, you sign in, right? And you put in your faculty email and your password. It will take you then to this cluster of apps. And so this cluster of apps, as you can see here, is going to have, in fact, I'm going to take you to a slightly different page because I'm going to show you a couple of new apps that we're releasing. So here you see the Neuromuscular Rehabilitation app. So this is in our beta test platform. You probably won't see this for another week or two as we iron out all the kinks. But let me take us first to the NeuroExam app and show you how we've carefully organized the content so that it makes it easy for the students to cluster numerous tests into meaningful clumps. So when we build apps, we call these clumps. So here's the balance clump. And so just like Kathy said, many of the students will first go to watch the videos. They'll watch the videos ahead of time because that becomes the seed for discussion. If the first time they ever see the technique, is with you online, we've already missed a chance to pre-expose them, to kind of soften the soil. Now that you've talked and you've kind of guided them, they've self-guided themselves through all the common tests. So you can, actually recently just released this. This is the entire exam over the span of 4 minutes. So I basically took all of the tests.
Please stand up. Try not to use your hands for support.
So I basically connected all of the tests so that you could watch it all the way through once. And then you have each individual test for you to now talk through. The students, in fact, having watched a lot of this, can go into lab or practice on their own. These are not high-risk tests. And by the time they get to your online synchronous sessions, your ability to now just pull these techniques up, talk about a few of them, and know that they have already watched them all allows for a lot of rich discussion and contextualization, which I think is really an advancement of how we can teach them. Because the lab time then is really about integration and deeper understanding, not just first exposure. We deal with this all the time in ortho. The first exposure to shoulder lab, the end result of that is always a mess. There's too much stuff. There's no context. All of it is really a jumbled mess. But because they play through our apps ahead of time, they have tried some of those techniques out. A lot of the time in the synchronous session is now built around this type of patient, this decision about how to test and look for these impairments. Here are some interventions that we would use related to those impairments. So a lot of storytelling and connecting of dots. So I think, Kathy, for you as well, having placed these seeds in their mind, given them the freedom to explore, right? It's basically a guided safari. The freedom to explore, because this becomes the seeds of your discussion for your synchronous sessions.
Absolutely.
So you can see, for example, if you go to tone, you have your muscle tone assessments, your modified Ashworth. Typically, there's an introduction about a cluster of tests, clonus, upright spasticity. And then this app actually goes all the way into your diagnosis specific. So your stroke, your Fugl-Meyer and stream, everything has been filmed already for you. That includes ASIA for spinal cord injury, both motor and sensory. Now, I would also say that we carefully went through and found a moment in the video and took screenshots of every key moment, because not everything has to be watched in its entirety. For many students, just the appropriate image triggers the memory. And so we carefully went through and added all of these different images to help the students really integrate this deep into their mind. This will also, of course, include vestibular, and all of these different videos now are available for you to just reference in your classroom. Any comments or questions about this so far? So you can see that a lot of the content related to your NeuroExam app, related to your NeuroExam curriculum, is all here in one place. The students have it before class, so pre-exposure. The students will watch it again when we get to class together, because it's very hard to demonstrate all of this stuff over Zoom. And then the students will take this with them into the clinic. So I think that gives you a little bit of a glimpse into the NeuroExam app. Kathy, did you want to make any other comments related to this?
I think the thing to remember is that, for us that do these tests all the time, they're kind of embedded in your memory. But if it's a test that you're unfamiliar with, like if you switch facilities and one facility does something one way versus another way. Even once you're out there and you're working, this is a nice resource too. So not only in school, but you can take this into the clinic with you. And then some of these other tests that maybe are not as familiar or common to me specifically, I'm like, oh, I gotta look this one up. So it's a nice refresher. It's much easier for us to look at a video too,
right,
than to go find some PDF, right? You can just take a look on your iPad or whatever. You can pull it out, take a look at it. So this is like, when you have a patient, you say, I'll be right back.
Right.
And then you run around to the office, you look at something, you come back out. So it's very user-friendly for clinicians
To assess for dysdiadochokinesia, have your patient seated with both hands on their lap, palms facing down. Instruct your patient to rapidly alternate palms up and palms down on both hands. As they do this, assess to make sure both hands are moving together. Another way you can assess dysdiadochokinesia is by starting with one palm facing up and one palm facing down. Instruct your patient to alternate the position of their hands. As they do this, make sure that both their hands are moving opposite of the other.
Now, certainly, you can narrate yourself. You can turn the volume off, talk about it as you would, however you want to do that. Many of our new apps, we actually have a high-speed video. I'm not sure. We're trying to decide whether to apply the high-speed video option to all videos. But certainly, these videos are here available for you to narrate over as well, so that you can I think the useful part is it's always available. You don't have to dig it out of Google Drive. You don't have to dig it out of your Dropbox or your box. It is always organized for you, ready for you to access, and that makes the delivery that much smoother, and that helps the student also access these videos that much easier. One of the things that I think about a lot is students need to see the faculty open the app. They need to see the faculty go to places where they found the techniques that they're showing, because those breadcrumbs, which you see up here, are part of the organization pathway for the students. When they first go into the app, it can be very overwhelming. They need to be able to say, hey, we're in balance week. Dr. Kumagai Shimamura said, I need to look through these balance techniques, so I'm going to go and sort myself out, familiarize myself with the apps. I think that's part of, it's like helping a student become familiar with the textbook. They know how to thumb to the right chapters because they've used it multiple times. So for them to pre-expose themselves once, to try some of these techniques out, I believe that there should be a call to action from the faculty. Try some of these out. We're going to discuss these together on Thursday when we meet. So I think there's this like call to action for the students to not be so passive. I think this is what will help the students actually get through this period, and perhaps is even best practice anyways if we get back to our face-to-face brick and mortar kind of residential program, setup. Okay, so here's what I wanted to mention about augmenting your labs with high definition videos. So if you take, for example...
So what you see is your typical neuro lab. This is the balance lab. You have a number of different techniques that you want the students to learn. The hard part is being able to show them and pre-expose them to these techniques. So what you can do is go to the PhysioU Educator free resources. From here, you can go to the master video cheat sheet. And what you'll see now is a master list of all the videos that you can use to augment your classroom. So if you go to the NeuroExam here, you know that Romberg is one of the key techniques that you need. So you'll type in Control F or Command F, Romberg, and there it is. You have the different techniques that you want. You can copy the technique, put it back into your document here, and usually what I do is I click on the app. It takes me to, this is exactly what your students will see. They can preview these videos. I usually like to grab a screenshot just to make my lab trigger a memory on how to do these techniques, how to do these tests. So I will add that right here. So from here, you can grab the screenshot, have it right in. And now you have a completely playable lab. You can also take this and just hyperlink the image. So now when your students click on the image, it will take them directly to the video. You can do that with all the different tests here.
So I hope that gives you a glimpse.
All ready for you to enhance your lab manual.
I hope that gives you a glimpse of how simple it can be for you to now have videos for pretty much your entire NeuroExam portion of your neuro curriculum. So my thoughts relate to motor skill training. So ortho has so many techniques every week, which is what is giving me nightmares about trying to compress that into less than my typical 2 semesters. So really it made me think about a process that the students can rely on, that they will know every week when I learn a new set of motor skills, my professor has a pathway for me to master these techniques. So what we've done in our program is the students preview the videos. There's a call to action in the syllabus. Guys, preview the balance lab. We want you to try some of these tests and techniques out before we get to official lab, because official lab will become the 3rd exposure. This is where Kathy can pull up the balance lab. She can talk about why, she can create a context of the types of patients that balance testing would be relevant for. And then she can start clicking on the links inside the balance lab that the students have already seen before. So she can actually engage with the students back and forth about what are some of the balance tests you guys learned. Why would you choose one over the other? All of that conversation can happen because of the pre-exposure. If you don't have the pre-exposure, you know that the synchronous online lab sessions end up becoming the faculty member is the driver and the students are the passenger, and they're just going to keep taking information in. But in fact, when you have pre-exposed them to a lot of these techniques, this time becomes very precious, the synchronous discussion and review. The other thing that we've traditionally done, we've always done actually in all of our skills-based classes, is the virtual checkoff. So the students will have a 15-minute checkoff time every week, and they are asked to perform certain skills. These certain skills, this virtual checkoff, mimics how we will test them in the final online practical. Now, there will be a skills bootcamp and kind of a checkoff / exam when we all come back in late summer or early fall. But imagine that this process of skill development could be happening every week. The virtual checkoff keeps the students honest. It gives them a little bit of one-on-one time with the TA. The faculty are not doing the virtual checkoffs. We're too busy trying to figure out what we're going to talk about tomorrow. But that we have a group of the students that did really well in the neuro class, we've handpicked them to be the checkoff people. So they will ask the students to do the techniques, give them a little bit of one-on-one feedback, and this will happen every week of the semester where motor skills are being trained. I think this is a very important pathway for faculty to consider, because imagine trying to do all of these techniques come boot camp in fall. The amount, the volume, the sheer volume is going to be so overwhelming that not only will it kill us as faculty to show all of that content in a week and a half, but it will also be next to impossible for the students to really grasp. So I really think that a systematic pathway to learning motor skills throughout the online semesters that we're having is a very important stepping stone. It will make boot camp that much more effective. One other thing that we've been talking a lot about in ortho is there are certain skill sets in ortho, and I believe there are certain skill sets in neuro as well, that require more focused time. So when you have your boot camp hours, they should be spent, the majority of those boot camp hours should be spent on the higher level skill sets. The lower level skill sets, we are going to do at the beginning of each boot camp day, we are going to do a mass calling out of techniques, low-level, easy techniques. We're just going to call them out, and we're going to wander around, and students are going to perform it because they've done them. They've done their virtual checkoffs. So we're going to get them to refresh all of these level 1, lower-level motor skills in mass. And then we'll slow everything down for the last 3 hours and focus on all the level 2 skills. We may want to demonstrate certain things. So again, something for you to consider. What boot camp should look like is not a mass, I need to get a whole semester's of skills done in 5 days. It really should be a review of the easy stuff and then focus time on the harder stuff. That is probably the best use of your time. This is what we're planning to do in ortho. Any comments about that, or any thoughts that people have had as you're looking towards your boot camps in fall? I'm just going to take a moment here to open it up for a quick chat. Any comments or feedback about what I've mentioned? And remember,
hey Mike,
you're muted. Yes, Jamie.
I have a question from the chat that I was sharing. So how do you actually get your students to do the mental imagery and practice? How are you following through that they are doing that?
Yeah,
in preparation the way they should be?
So I did a little bit of a literature review about this mental imagery stuff because we're worried about even our modalities class that's happening now. So you would think that, well, it's modalities. Well, there's a lot that goes on to set up a cervical traction. And we think that there's evidence to show that if you can think through the process of setting someone up, opening up the holders of the occiput, right? The little device, pushing the right buttons. We're asking the students to do that because they don't have the device with them. So the same thing in ortho. Many times, even when we're in the brick and mortar face-to-face class, I would have the students perform the steps to setting up a manipulation with me. We're just playing air guitar, but it's an air manipulation. So I'll call out the steps. Everybody have your patient in side lying. Now, let's flex the lumbar spine. So everybody's doing the technique with me, but we're just doing it in the air, mental imagery. So it could very well be the same thing for neuro if they can imagine. So when I show you the NeuroRehab app, a lot of the techniques that you're going to need to teach them are there. So now that they've previewed those techniques, I ask them to actually go through the lab list again and try to envision and do the air technique of this facilitation, getting someone to sit up tall, whatever those things are. I think there's some value in having them play the air guitar to try it out. It doesn't take long, but it's the development of the skill set in lieu of not having partners to try this on. I think it's just better than nothing, and we know that athletes do it all the time for high performance motor skills. I don't know, do you have any thoughts about that, Jamie? Or comments?
No, I mean, I completely agree. I guess my challenge is you can tell them until you're blue in the face to get to do it, but how do you encourage the culture that they actually are ready and prepared when they walk in the classroom?
Yeah, one, I think there has to be a sales job that happens. The sales job is I will show my students this. The captain of the ship, so I'm the captain of the ortho ship. The captain of the ship has to have clear orders for his team to succeed together. And so at the beginning of my class, we share that this is the process to developing the skills you need to become an entry-level clinician, to prepare you for the clinic. So my expectation of them is very fine-tuned. It is, for every lab, you're going to need to do a preview of the lab handout. You're going to have to go through the lab handout and either practice it on someone or use mental imagery. You try it yourself. You play your air guitar. Every single one of those techniques. Now, some of the students will be like, that's ridiculous. You can pull up any article about mental imagery and show that there's benefits to developing your motor skill or higher performance. So I think that can help. I can post some of those articles in the faculty resources that I pulled up. But I sell it to them hard because they all recognize that same issue, which is I don't know when I'm going to be back in lab together with the faculty. So I tell them, guys, if we do not go through this process weekly, you can only imagine how overwhelming it's going to be when we get to boot camp in fall. This is the process that we have designed for you intentionally to help you develop this step by step. That's all. I would just sell it hard. And then the virtual checkoffs, I think when they get to the virtual checkoffs, they will see the value of this process. So that without some type of virtual checkoff, everything kind of just floats around into nebula, right? No one really is keeping them accountable. They don't see the benefits of any of this. And so they'll wander in glazed, eyes glazed to boot camp, and they'll wander out eyes glazed from boot camp. So I really think that there needs to be a very clear call to action from the faculty. And then an encouragement every week. Guys, remember, this is how we are going to do this. It is your responsibility, and you will see how it will impact your learning. That's how I would do it. Okay, so seeing the big picture. Kathy, is there any other comments?
I don't think so. I'm going through the chat. Okay. And, we're all kind of dealing with the same thing, right? So it's like, how do you get people to prepare and be invested and engage when they're in their jammies and in their in the privacy of their own bedroom. And
their puppies wandering around.
It's been a bit of a challenge, but it really is trying to front load the whole concept of why it's important to master these skills under whatever circumstance.
Right.
So yeah.
So let me share with you about seeing the big picture. So PhysioU has partnered with MUSC to bring to you the NeuroRehab app. All right. The NeuroRehab app is in its initial form is ready. We are ironing out some of the details, some of the kinks actually, to make it easy for you to use. I'm going to take you there right now in our beta platform. So here is, this is our development platform, and I'm going to go back down to our neuromuscular rehabilitation app. So here, it will bring you to the library, which is what Sara has created. So I don't know, Sara, I don't think Sara's here, but Sara, are you here? Okay, if Sara's here, she can jump in. But what I would say is what you'll see in the neuromuscular video library is a full evaluation. I thought this was just the coolest thing. So what she has done is she's done a full evaluation on a patient, on a real patient. So that includes the subjective exam, and even more cool, I think, is a little quiz that helps the students learn, pre-expose them to and focus their attention to key parts of the exam. So here is this basic interview going on.
Hey, hi Malika, I'm Sara. I'm going to be your physical therapist today, and I wanted to ask you a couple questions before we get started. Is it okay?
Yeah.
So as she goes through the interview, the questions are saying things like, hey, based on the patient's stated reasons for not returning to work, what testing would you perform for a baseline assessment? Now, I want you to know that this is at the very beginning of NeuroRehab. They actually don't know much yet. Or they may have already taken their NeuroExam class, which is how our course is designed, so they know a lot of these tests. But the nice thing is, all of these answers, if you choose it wrong, they will tell you why you're wrong. If they choose it right, they will kind of be encouraged. This is correct. Move on to the next question. So asynchronously, they are going to learn. And what are they going? And they are going to be able to see a full evaluation that includes tone and spasticity testing. That will include objective outcome measures. So the application of a lot of these tests that they learned in their NeuroExam class, or the examination component of the class. So we can take a look at 5 times sit to stand and look at the quiz questions here.
So, Malika, I'm going to have you come to stand 5 times as fast as you can without using your arms. And I will time you. So you're just going to go up and down 5 times. Try not to pause between. Just do it as quickly as you can, maintaining safety. Are you ready? If you can do it without your hands, yes, no hands. Ready, set, go. 1, 2, 3, 4, 5, 13 seconds, 0.62, 13.62. Good job.
So you can
5 times hit the stand.
So you can see in that they've asked what is the appropriate, why did you choose this outcome measure? Based on the results, is this test an appropriate one for the patient? Right? So you can basically see that this is a self-guided, big picture, connecting the dots as to what it would look like if you did a NeuroExam on a real patient. So I think that's very powerful. The second part of the conversation is Sara and I are thinking about how to film all the interventions. So we will, based on this examination or a new patient that we have in mind, we will film the full examination, we will film all the objective tests, and then we'll choose 4 or 5 key impairments to manage and then refilm the results, the improvement in the movement. So that is a glimpse of what she has for you in the evaluation section. So all of this testing related to one patient. Here are the interventions that she's filmed. So here are all your common interventions. Again, this is just a reference library because it's going to be really hard to teach these things while we are stuck online. Let's take a look, I think, at spasticity, rigidity, decreased range of motion. Okay, so they've actually very carefully and gone through and closed captioned all of this. We are also doing the same thing for all of our own videos. So I believe Sara uses this as her library for all the common techniques that she's going to use, and she's classified it based on what she's trying to manage. Okay, so this will all be available for you to utilize as a reference or examples for your students. The other thing that she and I have been working on is her case studies library. So the Parkinson's patient, the TBI patients, the stroke patients, we are going to go back and rename all of these videos. So, I mean, this is just our first stab at this. But these will then be 47-year-old patient with, with whatever stroke that they had. So these cases, actually Sara has detailed cases written up, and I've asked her to make it in such a way that students could utilize these videos and then go into Zoom breakout rooms and discuss things that they see. She's adding in clinical reasoning questions with answers, and part of it will reveal the subjective. We'll ask them to determine what kind of testing they would want to do. Then we'll reveal the objective findings and ask them what kind of interventions they want to do. So a lot of these are in the works, but I hope that this type of patient case scenarios will again make it easier for you to develop the context that is really important for us to help develop these student clinicians. So you can see all of these different case studies and different patients in different, with different conditions. Okay. So we are super excited to bring this as a powerful tool for you to utilize, and I hope will help to really bring the big picture together. I know that myself and our new neuro instructor at APU, Mary Hudson McKinney, we have talked about filming these main conditions, probably add in MS here. We are going to film a patient from beginning to end, evaluation, movement analysis, objective testing, and then treatment and post-treatment reassessment of their movement. We're going to do one example for each patient type, common patient type, and that will also become part of how we help the students really tie the dots together. I have a vision for using those videos also as a way to help the students develop their clinical reasoning. I'll share that with you as that begins to firm up, but this is something that Mary and I have planned, hopefully this summer, later this summer. Okay, so let me move back. Any comments or questions about this, Kathy? Or anybody?
No, I don't think people are asking when this is going to be ready, the NeuroRehab.
Yeah, NeuroRehab is technically already ready.
I said a few weeks?
Yeah, probably 2 weeks.
Okay, perfect.
Yeah, we are just ironing out the kinks and testing it out because the moment we release something that doesn't work, we get lots of emails. So it's really imperative for us to test things and work on things carefully before we throw it out into the wild. I would say this, though, that as always, PhysioU is ready to serve you as faculty and serve the students, which means that we always love your feedback. I got feedback this morning from a colleague in Colorado, and we will go back in and film. We always do that. This is why we built this in a web-based platform. It was because it was infinitely changeable, and it will always be the latest edition. That is what the subscription from the students is supporting. And we hope that we keep the price in a very reasonable, if you think about all the different classes that we support, I think the amount that we are asking is way more than reasonable. But the support from you as faculty in terms of vetting the content, giving us constructive feedback, those things they're very meaningful to us. And Kathy and I, we take this feedback, we bring it back to the team, and then we go film. So, all right, so let me take us on to the next piece here. So here's developmental milestones. So this is also a ongoing project. So developmental milestones we released at CSM. You can see that here. And what we did was we tried to follow the same baby for the first 12 months of his life. So this is the same baby. The only month we didn't capture him is month 0. It's too early, and but he did come on every month. So now you have a very easy to access video that you can utilize to help the students look at the baby the way you would look at the baby, right? The way a clinician would look at them. So here's the observations, here's the atypical development, and the fun thing is you can see the same baby from month to month. That was him in prone. This is him in prone at month 0, at month 1. So clearly you can see as the child develops and the differences as you go from month to month doing different tasks, supported sitting, pull to sit. All of these are fantastic opportunities to help the students see the pathway of development. So these are all silent and available for you to narrate over. There was a lot of crying and screaming in the filming, and we actually filmed a lot of different babies. So we will release more and more children that you can utilize as case studies. Here also you will see the reflexes. What the stimulus is, what the response is, when it appears, when it integrates. right? These are not to replace the textbook here. This is a way to take the learning deeper. It is meant to be the Cliff Notes. It's meant to make your life easier to illustrate things. And then here is our standardized testing. So what we did for standardized testing was we thought about the problem, which is there's a lot of standardized tests. It would be nice to group them into one place and direct the students on where to get them and basic information related to them. And we could sort it by diagnosis because that was one of the issues we were having. Students didn't know when to choose which test. So we sort it by diagnosis. Here's the TIMP. Of course, these are proprietary tools, so we have a little bit of basic information here. We will direct them to the best resource to learn more about it. So all of these are linked. And we will also direct them to where they can buy the instrument. So again, we've carefully tried to organize this to make the conversation about the choice of test, to become familiar, to cluster them in meaningful clumps so that students will be able to know when to use what. And then, of course, we did this by age as well. The cool part is we created standardized testing case studies. So now you can have the students, it's linked to the instrument for them to buy. This is just a small part of the instrument for your case study.
Okay, you're going to touch your finger to your nose until I say stop. Ready, go.
And now you can ask the students to go ahead and score it. The answer key is here. And now you can have a discussion about when you would use it, how would you use it, but I think this allows for some interactivity. And again, I would make a call for any faculty who have content, who has content that we could utilize as these little case studies. We would happily integrate that to make this resource even better for the masses. So please feel free, if ever you have the inspiration to be a part of this work, have this content available that you have, all of this of course is, there's waivers that have to be sent out to make this available, but we think that this is the future of helping students to learn and integrate this content into real clinical practice. Okay, so that is the Developmental Milestones app. We have on our list to film all the common interventions that a pediatric therapist would commonly use. This is on our list. It'll probably still take us, really don't know when it'll be safe to bring babies back so we can actually film them, but it is on our list of things to do. So you'll have the developmental milestones and you'll have a interventions tab where a lot of the interventions will be there. Okay, so that is the Milestones app. Now, in closing, I want to give you a quick sneak peek of some things that are coming out soon. So, this is a collaboration between PhysioU and the University of Idaho. So, Dr. Edie Kendall and Dr. Brian Cleveley, who is actually a computer science animations professor, we brought the Pediatric Gait virtual clinic, and it will be coming probably July 2020. We're testing it right now. We're a lot of little things that we want to add in. This is the latest edition. So some of these patients are real patients, and we purposely put them in the virtual reality environment to protect their anonymity over time. Some of these are just students mimicking the pathology and then us capturing it in the movement capture lab. So you can change the eye height, the eye level. You can stop the gait. You can now use the Edinburgh Visual Gait Score and apply and make the gait analysis a systematic process. So then you can also apply a posture grid. You can rotate around the patient. We beta tested this in our pediatrics class last semester. The students loved it, and then they gave us a bunch of feedback, and so we brought it back in-house to go and continue to make changes. So eventually, Edie is making a key. Every time they finish, this is an 8-year-old with hemiplegia, right hemiplegia. After they finish, they can compare with one another. They can go back and look at things that they thought they had seen correctly or incorrectly, and they can compare to the key as well. So I think this is a cool stepping stone. Application of gait analysis, using a objective and validated score, the Edinburgh Visual Gait Score. I think it's a great way to interact with the students and help make this more clinical. Okay, so that is movement analysis gamified.
Upper extremity, flexion, adduction, external rotation.
So you guys have asked about the PNF app.
Into here.
We spent about
we need to watch
20 hours. I'm going to take you there just for a second. 20 hours sorting through all the videos and beginning to get them ready. So what you'll see, let me think if this is the right thing to show. I think, yes, what you'll see is we went through, and this is essentially how we storyboard the entire app. So this is what is coming. You're going to have basic principles, the different techniques, the different types. It's organized probably by how you're going to teach it. So there's going to be some philosophy videos, some basic videos, or basic principle videos. Everyone has potential. We address the whole person. I mean, we built this with one of the clinicians from Kaiser Vallejo. So they'll be using this for their program as well. So a lot of the philosophy and basic principles will be there. You can see that this is really just the mock-up, but many of you have asked, so I thought I'd take you through it. When you go into the techniques, you'll see again little videos. And then when you go into the patterns, you can see this is how we organize the app so that we know exactly how we're going to film it, how we are going to create the logic for the programmers. So, of course, all of these are video. I've asked the programmers actually to put in a high-speed function. And we've tried our best also to film the functional application of some of these different techniques so that they're just not isolated techniques. We can see how they're integrated into function. So that's just a little glimpse of how we've basically tried to organize this app. We were going to give it to the programmers last week. We thought it was already in our final comb through. There were a few areas that we weren't sure where the videos were. I mean, it's a massive project. We've been working on this project for over 2 years. And so I hope that probably by fall, this will be available. It is a work in progress, but you can see how a lot of that, I mean, everything is edited and ready to go. There's just a lot of work that goes into creating the logic with the programmers. It's a very expensive process to build these apps. Any comments about that, Kathy?
Upper extremity flexion.
I'm sorry, Mike. Your chat is like blowing up. So.
Oh, okay. That's okay.
No, it's great. You know, people have like great ideas. So, you know, for everybody, this is a work in progress, and Mike and everybody is very dedicated to making sure that things are updated. So, because people are, asking a lot of questions about, all these different things. And, the answer is these are all amazing ideas. And then hopefully things will continue to morph and be updated. And as times change and as our practice changes, we will also be, up there changing things so that, we're on the cutting edge of things.
And Kathy, if you're able to remember, even though your memory is much like mine,
yes,
if you're able to remember, are you scribbling? Squirrel, right? If you're scribbling some of these down, this type of feedback is so critical as we continue to develop content.
Oh, so. I know. No, my mind is a steel trap.
Okay, got it. Okay.
With a minor leak. But.
Okay, right. So here is the neurologic movement dysfunction. So Kathy and I had thought about, hey, you know what? It would be really cool to film all of our patient day patients doing functional movements so that we could compare them to one of our grad students who has no dysfunction. He's moving relatively well. So that you could compare side to side a lot of these different movements. And so I think we have our Parkinson's patient filmed, our traumatic brain injury person filmed. So this is on our list. We filmed a lot of this already. So what we hope to provide for you is now a resource of a number of different functional movements that you will now be able to use for task or movement analysis. And then you can pull up the video side by side of someone who does it easily and normally, and someone who has to do all kinds of different compensations to get up. So this is also in the works. There's not enough hours in the day for me to keep building these things, but I want you to see the direction that we're going with this.
We also have variations of normal too, Mike, for that. So we filmed a lot of people who are neurologically considered to be intact, but everybody has different muscle joint length.
Right.
Right. So
ratios.
The strategy they choose for under normal conditions is also different. So we filmed a slew of normal people too, so you can see the differences between those people, and then compared to people who have very specific, neurological conditions too.
Right. And then the other thing I was going to say was I didn't want you to miss that the Gait app that we have actually has a lot of neurologic patients in there. So patients with neurologic dysfunction. So if you think about a lot of the analyze deviations, hip, you can see that we have a lot of these types of reference videos in there for you, as well as case studies that will include, so if you go back to analyze, case studies, you will have patients with common musculoskeletal conditions like, hallux rigidus and plantar fasciitis, but you'll also have patients that have, I'm just scrolling down here quickly, prosthetics and prosthesis, and then your post-stroke case study. This is an incomplete spinal cord injury case study. This is, I think, our diabetic neuropathy case study. So these are available for you to utilize to develop clinical reasoning as well. But of course, this is the Gait app. So what you're going to see is Gait. All right. So as we're getting close to the end here, I just want to show you actually yesterday, I think it was Monday. Well, yesterday, Teresa Bisson and I were talking about adding atypical videos into the NeuroExam app. So what used to look like this will now have a typical and atypical. When you click on atypical, you will get to watch what these tests look like on real patients. This is just a sample. We have a collection of these, and we're deciding right now which of these tests would benefit. Like sensation, maybe not, but a lot of the coordination, the spasticity, it would be nice to see real patients. This is one of the things that we're working on. Surprise, Kathy.
Well, we already did that. We already have a bunch of those filmed.
Yeah, we have some of those. For sure. Yeah, I just haven't had time to sort through them, but it's time. So,
Maybe you and I need a meeting.
Yeah. And then yesterday, we released our first simulation. So Jamie, who is on this call as well, she is excited to be a faculty contributor, helping us think through what would it look like to create a simulation for our students to be able to play through. So I'm just going to give you a quick glimpse here. So this is, our team built this yesterday. It took probably over a week to build, a couple weeks. You get to start by looking at your schedule, right? Jerry McGuire, he's coming in 10 a.m. We are expecting the students to do a chart review. So in the chart review, as they hover over the different tabs, you can learn about their vitals, common lab findings. Throughout the game, so we'll move on in the game here, there are little things like, hey, these are the medications that the patient's on. Please try to connect the dots, right? So we're trying to kind of connect pharmacology, which is what our students are doing right now. We're trying to bring it into the clinical setting and say, hey, what do you think about the medications that you see? Do you recognize what they're for? And how might this impact your patient? How might this influence your examination? So Coumadin, the patient's more at risk for bleeding. So here's your patient, Jerry. This is his basic story. And we tried to create the information in a flow that is consistent with a pattern of practice. So here's his history of present illness. Based on that, what type of CVA most likely did the patient experience? So there's as much interaction, right? After the initial symptoms, how long after the initial symptoms can they receive the TPA? What kind of stroke did the patient have? And now let's move on through the social history. Oh, he lives in a 2-story house. What concerns do you have about the patient's living situation? He lives in a 2-story home. Okay, great. What are some short-term goals you would like to set up for the patient? So it's based on what the patient's established goals are, of course. And here is the objective exam. So as they hover over different parts of it, you'll see here's the NeuroExam, here's some vitals, some range of motion assessment, some muscle strength. The reason why we did this is partly because this is the very early parts of neuro. We're giving them too many choices to make, can make it very, very difficult for them to see the big picture. So what we've tried to do is provide for them in these initial round of simulations, what are the common tests that would have been relevant to do for these patients, so they can begin to see the picture. Later, we will build sims that are more complicated, a level 2 sim, that will ask them to make more choices about the types of tests that they want to do. So let's move on and take a look at the patient. We want to do some functional testing. This is where patient videos can come in very handy. So we want the student to do a little bit of analysis, and we will ask them questions about why does this person have this right lateral weight shift? Okay. What would you like to assess because of this? I'll tell you that this first round, Jamie, myself, and Tatiana, as we're building these, we started dreaming about what kind of questions we would want. So you chose the Berg. Here's the Berg score. These are the things that the patient had problems with. So we're thinking through this process, which is partly why I'm excited to show this to you to get some of your feedback. What are some of the things that you would like to see? What are some of the things you would like to ask? You'll never know until we build the first version. So you could consider this as just our beta test version. But we think of this as a way to help students pull things together in a low stakes environment. He's doing his gait analysis. What method does your patient use to clear his extremity? And we always felt that it was relevant to create a objective findings like summary slide, because all the information is delivered slide by slide. It's helpful to see all the pieces together. Now identify the key impairments related to their activity limitations. And then to begin to set some appropriate goals, apply some appropriate treatments. Again, this is the early stage. Once we begin to build out the sims and understand what it is that we actually need to film or need to capture, we can then build the sims out more fully. This is really just our first attempt. So when your student makes the right choices, they get a score that you could potentially utilize for grading, but it actually helps the student get some of their own feedback as they go through the simulations. So that takes us to the end of the deep dive. I hope that I think we can just open it up for a few minutes. I know we're kind of have run out of time, but I'm excited to hear some of your thoughts, some ideas you might have. And know also that your students all have full access to all of these apps through August 15. We've given full access to you. All you have to do is apply for the codes through physiou.com/coronavirus. All faculty, if you don't have access yet, please feel free to email me and we'll get you and your colleagues access.